What are my postoperative instructions following a breast reduction? These are super important and will vary by surgeon, but I wanted to give you an idea of what it's like in my clinic for my patients and during their postoperative time period. So immediately after surgery, you'll be placed into a breast binder. This is going to be a tube top or other garment that's going to kind of generally support you during those first couple days after surgery. Now, after the first 3 days, you can remove that tube top and you can shower after about 72 hours. Some surgeons allow their patients to shower for 48 hours, but I want those incisions nice and sealed before you expose them to water. We don't want you taking a bath and submerging these incisions in any bath water or pool water for at least a month after surgery. So remember, this is a shower, not a bath. After we shower, we can go into a non-underwire front zip or front snap sports bra, and we're gonna keep that on 23 hours a day for the first 6 weeks after surgery. Okay, so no underwire bra for 6 weeks after surgery. During this time period, I will ask you to generally limit your activity. Now, this means no lifting, anything over 10 pounds, and also no super strenuous physical activity, meaning no zone 2 heart rate or above. Now, after the first 2 to 3 weeks, depending on how you're healing, we will allow you to go back to low to no impact aerobic physical activity at a zone 1 heart rate or below. So think like a stationary bike, elliptical without arms, or walking as long as that heart rate is below 120. As long as you don't have any wound healing issues, you can also return to work as long as you're not lifting. Now, this is a pretty general idea of what to expect after surgery. Some other common questions that I get are, what about pain medicine? Well, thankfully, a breast reduction, interestingly enough, is not a very painful operation. Most women will take opioid pain medication for about 2 to 3 days after surgery, and after that transition to Tylenol and ibuprofen, which is safe to use after 72 hours. Another important question is, when can I drive? Well, driving is a little bit of a nebulous concept. There's no one time period that fits everybody. For me, when my patients have been off of pain medicine for more than about 24 hours, which is of course opioid pain medication, and when they feel like they can generically drive, meaning they're comfortable having a seatbelt across their chest and comfortable stopping short when they need to in a car, then I will allow them to drive. Every surgeon's a little bit different, but in general, you can expect this to be about 1.5 to 2 weeks before you're really comfortable getting behind the wheel of a car. Some other important things to note after surgery is that you will be very swollen for upwards of about 6 weeks after surgery. This includes not only the breast, but also the areas where we'll perform liposuction in the lateral aspects of the breast. All these areas may be swollen and painful for up to 6 weeks after surgery, although in general, the pain will subside after about 2 to 3 days. The number one area that I get extended complaints about soreness is actually the lateral aspect of the breast with liposuction, which can remain a little bit sore and swollen for upwards of about a month or so. Thankfully, a breast reduction is very well tolerated, and for the vast majority of women goes off without a hitch, without any complications or any problems. This is a really excellent surgery with minimal downtime overall, and can really be a huge boost to confidence as well as increase your activities of daily living. So if you have any other questions about breast reduction, make sure to ask your surgeon about them, and make sure that your surgeon is going over all the appropriate things with you, because remember, it's your body and your results that matter.